All right, good morning and good afternoon, everyone. Thank you for joining us. It looks like we've got about 43 attendees here so far, and we're excited for more to join. My name is Josh Thompson. I am an account executive here at Microsoft, and I just wanted to say welcome to our Voices in Healthcare Cloud. And so just to start things off, Voices in Healthcare Cloud is a series that myself, Shelley Avery and Vasu Sharma have put together as different representatives here at Microsoft in healthcare to help share the impact that we're seeing our technology have on healthcare organizations. And so we're really excited to meet and chat with you today. And we're gonna just walk you through a few housekeeping items before we get started. So first, we would love for you to ask, any questions that you have. We've got a few people here on the meeting with us to help answer and triage those questions. And we'd love for you to actually kick this off by sharing where you're joining us from. Our last session focused on Microsoft Viva. I think we had about 300 attendees, and they were from all over the United States, maybe one or two internationally. So we'd love to hear where you're joining us from to see if we can break our previous record. The questions are all moderated, so we may publish them to make them public for everybody or answer them as one-offs, but we will definitely do the best that we can to answer your questions. And this session is being recorded, so we'll post that recording to our Microsoft Health and Life Sciences blog here after the session. So feel free to share the link to that blog or go back and review the recording, once that's made available. In case this is your first Teams Live event, we just wanted to call out for the Q&A where to go to make sure that you ask and answer those questions. So you should see the little kind of double chat bubble button there at the top right of your screen. And that opens up this chat pane where you can go and see all of the questions and comments that people are making, and all of the ones that you've asked specifically. So now let's move on to the presentation. All right, so today we've got an overview of the Microsoft Cloud for Healthcare and Human-Centered Design. And so it's going to be hosted by Shelley Avery and Jake Thompson. And I will go ahead and let Shelley and then Jake introduce themselves. So Shelley, I will pass it over to you.
Awesome, Josh. And thank you so much, everyone, for joining. We are so excited to be able to speak to you guys today. For those of you who I haven't met, my name is Shelley Avery. I am in Houston, Texas. I've been at Microsoft about 5 years, focusing on working with our health and life sciences customers. And I am just truly passionate about working with our customers and helping them solve real world problems with our technology. I personally have a friend whose child is a survivor of pediatric cancer, and I just admire and give my honor to your clinical workers, whether you support them from a technical perspective or you're on the front line. So thank you so much for what you do, and excited to talk to you today. On to Jake.
All right, Jake.
Hey everybody, Jake Thompson out in the Washington, D.C., Maryland area. Former Chief Operating Officer and 20 years as a CRM administrator, developer, / consultant. And last 3 years at Microsoft, I've been working with our providers on their consumer engagement strategy. Also help lead some of our design thinking workshops with customers. Some of my favorite things to do with our customers is to go through hackathons with them. My wife is a nurse, and total shameless plug. And Josh, if you want to put the link in the chat window, we've got a nurse hack for health coming up in November. This topic is of the utmost importance: nurse retention, nurse recruitment. If anybody wants to geek out with the Microsoft team for a weekend, feel free to register. Nurses, HR team, IT team, feel free to join. And just a side note, we had an unplanned I don't know if any ED visit is a planned ED visit, but we had a ED visit last night, so there wasn't a lot of sleep in the Thompson household. But definitely grateful for our healthcare heroes, and special shout out if anybody's joined from University of Maryland Medical System. Thank you to the Shore Health team for taking care of my family last night.
All right. Yeah. Thank you, Jake and Shelly. By the way, I know there's 2 Jay Thompsons on here, no relation whatsoever. But we'll move on to the content here.
Awesome.
All right.
So I'm going to go ahead and kick us off. Really just starting with an overview of what the Microsoft Cloud for Healthcare is and what it can do for you. I have had a lot of customers ask, like, what is it really? And so I hope to demystify that for you. And then Jake and I will kind of wrap up with how we can help get started with really helping you understand what are some of the business and clinical challenges and how we can design solutions with that human-centered design and human element focus there. So the Microsoft Cloud for Healthcare is a platform. It's not a new cloud or a new tenant that Microsoft has released from a product perspective. What it is it's connecting all of our technologies together and customizing them for our healthcare customers. So we have focused on these kind of 3 core pillars that are shown here. And we feel that if we can enhance patient engagement, empower your health teams, and provide you with the improved clinical and operational insights needed, that is really going to truly transform, digitally transform, and provide all people the better experiences in your health system. So we focus on those 3 core pillars, and underlying that is with all of our security and compliance that comes native in the Microsoft platform, making sure that we protect your health information, staying HIPAA compliant, making sure we are HITRUST certified while we are enabling better experiences for all of the people inside of healthcare. To get started, what we are truly doing is we're putting your data at the center of everything. Your patient data, your clinical data, your provider information, your employees, and wrapping that around our secure and compliant platform. But when we really focus on enabling your people, whether it's a patient external to your organization, or an employee, a clinical worker, a care team member, or even back office, we want everyone to have better experiences and better engagement with the people they work with. And so you can see here, we have various different capabilities that are being built and delivered for you. Most of our customers have a little bit of all of this, but possibly these are being delivered in a way that are single point of solutions, or they're siloed applications, or even copies of data are being replicated around the organization. And so we really feel like unleashing your data at the center, it empowers your employees and your care team members to quickly be able to curate and deliver great experiences and great solutions on top of that data. So just kind of building up from the ground, a house always starts with the foundation. And so again, we want to start with your existing data sources, your consumer data, your claims data, clinical data, social determinants of health, IOMT, EMR data can all come together and be aggregated into a unified data source. So then you can build interoperability using Azure's AI and ML to do predictive analytics, or even bringing in that IoT capability. We use a common data model that allows that data to become interoperable with Microsoft first-party applications, custom applications, and our partner applications. And so by putting it into a common data model, it really allows that data to be unleashed for your citizen developers and your employees to create the experiences and the solutions that they need, all pinned on that Microsoft platform. With that, our partner ecosystem is also able to take advantage of this aggregation of your existing data sources on the common data platform so that we can help future-proof our healthcare solutions by really investing in this enterprise-level platform approach. And so everyone inside and outside of the organization in this industry of healthcare can really have better experiences, better care, when we are able to unleash your data and deliver these great solutions to your employees and patients.
Hey, Shelley, can I add some commentary of what we're hearing in the field at this point?
Absolutely, please.
So, probably a lot of us that have been working in the field, the last couple of slides might have felt a little bit like, wow, these are like the rainbows and kittens slides, right? And when we're talking with a lot of our provider customers right now, we're really focused on the problems, and what keeps coming up over and over again is, look, we've been responding for the last year and a half, and top of mind right now, critical is we've got to recover. We've got to recover financially. And I think a lot of what we've seen up to this point, if we were to draw out, and we've done this with some customers, draw out like a cause and effect diagram, and we put on the far right recovering financially. Probably some of those capabilities were spokes. They were nodes in that cause effect diagram. But the ultimate goal is, how do we respond? How do we recover financially? At the same time, we're seeing tremendous resilience, tremendous hope, and a lot of our providers are thinking through right now, all right, this changed a lot. How do we, this is, like Dr. Klasko is calling this healthcare's iPhone moment. How do we reimagine experiences for our consumers, reimagine experiences for our care team? And I shared with some of y'all that as a former CRM admin, I love this view into the stack, because what we used to build was like forms over data. And truthfully, the tools that we were building were more beneficial to management to see what was going on, but that is completely changed now. And that data in the center, that fragmented data that may be an obstacle. I love thinking of the data flowing from the bottom up, and as data is flowing from, unifying it and making insights out of it and serving it up to the folks on the care team, we're actually increasing the value of the data. There's a great book that I recently read about finding that incumbent's advantage, and data is definitely one of those assets that can turn into, yes, it's an obstacle in many cases now, but can be an opportunity, and it can be a competitive advantage.
Yeah, Jake, I love that. I've heard you even describe it as, let's take the data that could have been or is possibly a weak point in the organization because it's segregated and it's not unified, and let's aggregate that and use that data to turn it into value as we go up this stack to be able to deliver solutions for each of the individuals who need them. And so a little bit about our partner ecosystem. We kind of have that top layer as our partners. And so this is not a complete list of our healthcare partner ecosystem, but it is a pretty good chunk of them. And hopefully you see many that you partner with, or at least a few. I'd like to call out a couple on here. Hopefully you have seen the recent announcements about Truveta, where Microsoft has announced a strategic partnership to accelerate Truveta's vision about aggregating patient data across multiple healthcare organizations. And possibly you are joining us from one of those healthcare organizations who has decided to partner with Truveta. Another one on here that we'll call out is Nuance. We know a lot of our customers are using Nuance. They are a great healthcare partner. And so Microsoft has decided, or is in negotiations to actually acquire Nuance and bring their technology into the Microsoft ecosystem. And so we'd love to just kind of remind you that it is a platform approach. It is your data being unleashed for these citizen developers, low code, no code app opportunities, Microsoft first party opportunities, but also these partners that we have. Some of them are integrators and some of them bring end-to-end solutions for you to your organization. Love to pause and see if anybody has any questions so far about what we've said, or any comments. Josh, I see there has been maybe one or two questions. Any that we should try to answer live? I see there's one around connecting Teams and Power Platform to Synapse. I believe that is exactly what we're saying, is kind of Synapse, or the data is that foundational layer. And so being able to use apps and Teams, or just using Teams from a collaboration perspective with that data, or Power Platform connecting to that data, are great examples of what we're talking about here.
And Shelley, sorry, I was talking on mute. You know, it wouldn't be a meeting if that didn't happen once. But yeah, I appreciate you calling that out. I didn't understand that it was asking about Synapse, but I think that's a great call out. Another great question that we have is, you know, one person made the comment that, hey, as a healthcare provider, most of these capabilities are also able to be delivered via an EMR. And so they're asking if the cloud for healthcare replicates the information, integrates the data from the EMR, but really just how that compares and contrasts with, you know, the EMR data and processes and things.
Yeah, great question. You know, Jake, maybe I'll take a stab, and would love for your commentary to add on. And whoever asked that question, thank you. We do believe that the EMR is the system of record, and we are not trying to displace it or become that EMR. But we do feel that there are some patient engagement, or even care team collaboration and communications, analytics that aren't native in the EMR. And so being able to use EMR data to build on or curate these capabilities that don't necessarily need to live in the EMR is what we're trying to do. I think we have a couple examples that we will share that hopefully will make that real for you.
And perfect, Shelley. I think, you know, we can certainly circle back on that question. It's, you know, essentially like a theme, I think, of this presentation. But another question is, how does this differentiate versus competitive offerings versus, you know, Google, Amazon, you know, et cetera? That may be a theme, again, that we can address, you know, throughout this dialogue, but curious if you have any thoughts here up front.
Yeah, that's a great question. And I think we will address that a little bit later. So good to know that it was asked, but maybe if we can hold off just a couple of minutes and we'll come back to that one for sure.
Perfect. No, I think we're good then. We can move on.
So one of the questions was around EMR data and or what we're trying to do. Is it to replace or to you know, how does it cooperate or intermediate with the EMR? And so we'd love to kind of take a minute just to tell you about a real world customer. Cleveland Clinic actually posted this case study, and we did exactly that. We were able to take real world patient information from their EMR around unfulfilled orders for 3 procedure types. We took unfulfilled colonoscopies and unfulfilled mammograms, and we over 6 months were able to use marketing and outreach on that data to gain 38% of those unfulfilled orders to schedule a visit as a result, including up to 30% closure rate of getting those colonoscopy and mammograms complete and those orders fulfilled. This was direct patient satisfaction. This was helping increase the lifetime and hopefully early detection of these patients. But not only that, for the Cleveland Clinic, this was increased revenue and increased clinician satisfaction for these patients, because we know these doctors want to ensure that their patients are healthy and safe. And so it just was a all around better experiences for those external and internal folks at the Cleveland Clinic. And so that was just the beginning. We have continued to partner with the Cleveland Clinic on the Microsoft Cloud for Health, bringing in more patient data from all of these different siloed places to unleash that data for delivering these outcomes and these capabilities that they are looking for inside of their organization.
And Shelley, I think this use case is really, I think it meets a lot of folks where they're at right now, especially since October is Breast Cancer Awareness Month, and what we've seen across many populations, and probably a lot of folks in this call are seeing this in their populations, is that there's been a lot of delayed care. But specifically in preventative screening mammographies, some of the stats are up to like 80% of women delayed care for preventative breast cancer screening. So not only is that, you know, a service line that's looking to recover and restore health for minis, there's a lot of women out there, and you know, probably a lot of us have had family members with this history, but it means that there's folks out there that may right now have a cancer diagnosis and they don't know about it. And we've seen folks, you know, to kind of stay on the EHR question, folks trying to leverage outbound notifications from EHR and stuff. And unfortunately, what's happening is they're getting blacklisted, like their email is getting blacklisted. And maybe the text messages aren't ramping up fast enough, or they don't have all the information. So definitely that engagement layer in addition to the EHR just augments that super strong foundation. And at the same time, you mentioned, I think we mentioned data a couple times. There's data that we want to bring into this equation that we don't want to bring into our EHR. There's a lot of anonymous, unstructured data. We don't want to house that in our EHR, and we want to reason over that outside of the HR, but then in combination with that data, and probably one other component of this that we're seeing is, you know, not to call it a specific vendor, but we've heard from some of our customers, you met one X, you met one X, and some of our providers that have recently gone through mergers and acquisitions, they may have multiple instances of that same EHR or variety of EHRs. So how do we get that real unified profile of a patient, of a consumer across all that data. And I think that's the benefit of. I heard one customer describe it the other day. I really liked it. The third leg in a three-legged stool. We need our EHR, we need our ERP, and we need a consumer engagement tool.
Yeah, and that really brings us to the healthcare consumer engagement hub talk track that Gartner has put out. And we at Microsoft have really leaned on this because we feel this is so important for healthcare industry. And, to Jake's point, the EMR is really great at being that system of record, that medical record, the source of truth. But when it comes to the consumer or patient engagement side of things, it's not always the best. And so I think someone asked very pointedly, what differentiates the Microsoft Cloud for healthcare compared to what is offered by major competitors like Google and Amazon? And so when you look at this healthcare consumer engagement hub, we see it as kind of three distinct areas. We see this kind of center layer as, they call it out as the CRM, process and execution, but it's really that consumer or patient engagement layer. And then this bottom part is the experience layer, face-to-face, in-person, omni-channel, text, email, virtual visit, social platforms. And so this CRM and this omni-channel environment, we have competitors in this space. But once you start getting up to this top, the information system platform, our consumer platform, and the connected care platform, that's really about the data. And so I feel like what differentiates us from our competitors in this space is there are a lot of CRM companies in the world. There are a lot of data companies in the world. And there are some omni-channel companies in the world. But we really feel like Microsoft is the best partner for all three of these. And we really don't think there's a platform out there, a single platform, a single cloud provider that can offer all of the components on this box. Now, we aren't trying to say we are the end all be all. We use our partners to help fill in some of these gaps, and we use our customers, because without you having the data and the clinical teams to deliver these solutions, it isn't an end-to-end solution. So we do have to partner in this area to make it real. But we do feel like we are set up very well to partner with our customers in helping you enable this healthcare consumer engagement hub, as Gartner has put it.
I don't see any additional questions so far, Shelley, but I think that that's just a great point, that the fact that Microsoft has strategic investments and products that can essentially fill the different pieces of this puzzle that are designed from the ground up to be integrated, helps organizations, healthcare organizations go farther faster versus trying to exacerbate one of the biggest problems that I think we see in healthcare, which is this idea of data interoperability and data siloing. And so, yeah, appreciate that answer to the previous question.
Thanks.
So Shelley and Josh, you guys are you're both spot on, and the premise of the Gartner framework is really about longitudinal engagement. How do we have that geriatrics to pediatrics engagement with our patients, even outside of the four walls between those episodes of care? How do we build that lifelong relationship with our consumers? And this is some work that some teammates and I were putting together the last couple of years. It's born out of the work that Gartner's done. It's what we've seen others prove out. in the industry, like a Livongo, for example, and their concept of applied health signals. And then naturally the work that we've done with other providers and created this blueprint that we like to work through with our customers as we consider this consumer engagement hub strategy. And as you'll notice on the far right, the consumer is right there, smack dab in the middle. And sometimes I think calling folks consumers in healthcare, I think sometimes that may come across should we be calling them consumers? They're patients, right? And what we're seeing is that by labeling folks consumers is really just we're saying, look, folks nowadays, they have agency, they have choice, and if anything, there's almost too much choice. There's a paradox of choice. So how do we help our providers be that trusted relationship? In many cases, it's already there, but how do we extend that? How do we retain that and protect that? So we work through this blueprint of aggregate, curate, orchestrate, and iterate. And on the far left, we've mentioned it before, we want to start with data, those traditional healthcare sources, the EHRs, the claims data, and map all of that across the different ontologies and crosswalks, et cetera, to make sense of it, to put together that true clinical timeline. But even doing really well at that, which there's work to be done there. But even if we did really great job of marrying up all that clinical data, it's still only 16% of a consumer profile. We really want to bring in all that digital dust of a consumer's healthcare journey and their journey outside of healthcare to really see that whole person, the physical and clinical, but also the mental, the spiritual, the emotional, psychological is really important right now. What's the why of this consumer? How are they making healthcare decisions? How do we motivate somebody? We'll talk about our friends in marketing in a bit, but marketing's really moved towards behavioral economics and nudge theory. So we want to understand the psychosocial aspects that our consumers have of financial. We're really kind of creating this digital twin, or another term that's been thrown around, an N of one, a segment of one. And then how do we take those insights and care as one? How do we care for everyone? How do we see folks that health equity is absolutely a passion project for many of us at Microsoft, and I know our customers as well. How do we make sure we care as one system, but also care for everyone equally? And then, as you can see, the different channels surrounding a consumer. How do we care anywhere? How do we care across different channels, across even different ecosystems? So aggregate's key, laying that solid data foundation, data that's secure and compliant and private, data that has quality. But after we get that digital twin, that N of one, that unified profile of our healthcare consumer, to bring that into an analytics platform. I heard Synapse brought up earlier. Yes, Synapse plus the development platform plus a product like Customer Insights. Shelley was talking about the question earlier, like what is Microsoft Cloud for Healthcare? It's a direction and a product. It's new capabilities that we bring out 2 times a year and take what might be those standard Microsoft products and add another layer of capabilities on top of those that are healthcare specific. So a product like our consumer data platform that seamlessly works with Azure Synapse for big data analytics under the hood turns into not just a industry agnostic consumer data platform, but patient insights. And then we can seamlessly, through a development and an integration platform, push those insights, push those automations to the different applications that might already exist. In fact, is probably one of the questions that comes up at this point is, hey, we already have fill in the blank. And one of the things I like about working with customers off of this blueprint is that it's tech agnostic at this point. What we're saying is we're taking a modular approach to this, and we want to help build the strategy around this, but we'll just light up what you need and plug it into the existing infrastructure around those different persona needs. And, depending on the use case, if we're working on, hey, how do we expand access? Well, maybe from a aggregate perspective, we need to bring in the right data for targeting and the curate. Let's focus on analytics for capacity or demand. Shelley mentioned partners earlier. We've got a great partner in Perception Health that helps our customers see that market intelligence, see that leakage data, and even better yet, predict over the population who may be trending towards a certain disease state and find out where those areas of demand are that our providers can help focus on. And then in the orchestrate area, maybe it's a self-scheduling tool and a guided scheduling tool for the folks in the access center. But I think the point here is whether it's a modular or an all-up cloud implementation and multiple workloads at the same time. What we're doing is we're taking a platform approach to this and not a patchwork standalone approach. One thing I don't want to miss to call out in the middle of the screen, because I'm really excited about this one, this idea of a solution store. This has come up a lot, and we deal with in our providers, hey, there's only so many resources to go around, and we're stretched thin. And what a solution store concept does is it really moves us to a mindset of abundance. And how do we line up the information that we've learned about our consumer? And there's buzzwords being floated around like next best actions and so on. But whether that's a care path or a health nudge or a coupon to healthy eating, or hey, maybe this person needs like an Uber ride. What's this library of health resources, education, DME product? There's this library of health resources that start to get us into this abundance of resources that we can line up to help our patients, help our consumers, not just with sick care, but changing that spectrum to wellness and keeping folks healthy. Shelley, did you want to mention anything on this blueprint?
I think that last point is really important, and so many of our big providers are about acute care and about sick care, but wellness and truly proactive care is something that can be achieved when you have the right engagement and access for the patients. And so that's what really excites me, and getting the you said the right care at the right time. There's different generational expectations of communication. A Gen Zer is going to want a different type of communication than a baby boomer. And then you also have social determinants of health, where there are folks who are in, don't have, direct access to the internet, or don't have access to proper care because of being, not in a centralized city. And so being able to help them where they are when they need it is absolutely what we're trying to accomplish here.
I'd love to dig into some of the personas around the wheel there, because yes, the consumer is the central focus, but again, we want to help reimagine experiences for our staff and for our care teams. When we talk about data friction from fragmented processes and systems, there's real friction that we want to help relieve for the internal teams, because it's empathy. I'm just going to share a Jake personal belief here, but our care teams are just some of the most empathetic folks that we'll probably ever meet. And when there's friction in our universe and they can't take care of folks, it's just a moral injury, and they want to take better care of their patients. They really want to get shots in arms. They want to get restore health in their population. So if we can remove those friction points, we did some work with one customer at one time, and she had so many different screens, she had so many different spreadsheets, et cetera, that she was working through. And we mentioned low-code app development, but if we can work with a frontline person that's just so inundated, and in 48 hours turn something around that shows how it could be better. No kidding, we did this for a customer, and she was literally crying because she was so happy that this is how she could do her work. So thinking through these different personas, yes, the patient, and yes, their consumer expectations have changed and dramatically. And what we're finding is that we're not just competing with other healthcare experiences, but we're actually in the consumer mind competing with their last best experience. And in fact, almost 70% of folks that were polled are like, hey, I want my healthcare experience to be literally the same as like an online shopping experience. And the battleground is really on folks' phones. Is how do we get your provider app, and I know digital front door is a bigger topic than just an app, but how do we get your app like in somebody's favorites, so they just know Contoso Health is part of their life. And then if you think about like the caregiver, the person that is taking care of the patient in many instances, we'd love to bring this persona to bear, because truthfully what we're seeing is that this is maybe the most underutilized member of the care team. So how do we engage them in that patient's care that they take care of? And of course, the clinician. There are insights that I think a lot of our clinicians would love to have at their fingertips, and not just filling up their alerts and filling up their in baskets, but if it's insights that we can draw and push back into the EHR at the right time, in the right format of their workflow, or if it's a Smart on Fire app, or if it's a simple tool that slides across the screen when they open up, Joy's or the patient's record. Can we bring insights right at the right time for our clinicians to save them time? Thinking about our physician liaisons, working with a lot of folks in this arena that their lives have been turned upside down. Not that everybody hasn't, but they couldn't go out, they couldn't travel. They've almost had to take on new roles within the system. But now, as we're talking through restoring and recovering revenue, their role is tantamount. And they spend maybe 30%, 40% of their time trying to find out who to call on, who's the best physician to talk to today to educate. If we can surface those insights for the physicians, all right, these are the splitters to target. This is the referral trend that we're seeing. This is the population that we could bring to that physician. That's some of the work that we're doing to relieve that friction for the physician liaisons. In conjunction, marketing teams. Usually like special forces teams, right? Like 5, 6, maybe 8 folks on these teams, and they are not just competing for wallet share anymore, but they're competing for mind share. Before it was how do we compete with sugary drink manufacturers that are with the budget of Super Bowl commercials? But now it's almost like an infodemic that they're competing with to help folks get back to healthy in their populations. At the same time, the regulations are changing. Marketing 3.0 is upon us. We are in the arena of end of cookies, and marketing teams now are not just how do we do email blasts, but how do we deliver experiences at those right moments, those macro and micro moments in somebody's journey. And then call center teams. Yes, it's about how can we help deflect and maybe automate a lot of the routines so they have more time for the complex to do concierge service, to really see that whole person across multiple events and channels. But what we're seeing is a transition to, I think call centers have historically been looked at like a cost center, but now next generation call centers are really about revenue creation. And we're actually seeing in some of our providers 150% increase in that call to appointment conversion. So if those physician liaisons are out gaining those referrals, think about this from a value chain perspective, we're getting those referrals, increasing referral trends, marketing teams are bringing in more patients that are interested in booking appointments. It's up to the access teams to actually book those appointments and turn that into net patient revenue. Then you think about enterprise care management and from a post-acute perspective, how do we connect with patients differently and help those care managers quarterback adoption and efficacy of care plans, especially around SDOH. And I really like what I'm hearing from folks saying, hey, we're not calling them social determinants of health anymore. We're calling them moral determinants of health. Just to highlight some of the success one of our customers is having, this opioid epidemic it's still going on. And by leveraging those insights that they can gain about the consumer and the patient at the same time, they're actually driving like a 3x ongoing abstinence rate above the national average. So it's not just about how do we get folks back into the health system that need care, but we're also seeing this deliver better outcomes in addition to experiences. And then thinking through home health, hospital at home as a hot topic. How do we admit acute to the home, remote patient monitoring, flip discharges, moving kind of rapid fire here because I know we're going to run out of time. But from a pop health perspective, how do we proactively engage in those patients, see those care gaps, and help reduce costs? But all of this ends with the goal in mind of how do we deliver a seamless journey. I'll steal a quote from Ed Marks in his recent book with Patty, that simplicity is digital nirvana. And I think that what we're seeing is the provider teams that can do this complete, seamless, simple journey for consumers. They will not just be the ones that are retaining the patients, but they will be the revered and loved consumer brands in the future of healthcare. So the question that typically comes up at this point is, where do we start? And in the last 5 or 6 minutes or so, I shared that I help lead some of our Catalyst engagements. Microsoft has adopted human-centered design to work with our customers. There's probably some folks on the call that have dabbled in this, maybe some folks that are really building this muscle. One of the benefits of doing this with our customers is we help build this muscle while we go through it. But it's really about not starting with the technology. We want to put technology towards the background and get really clear, really crisp on the problem we're solving and the solution that we want to bring to the table. Adoption is one of those areas, like I think a lot of us have been doing this for a while, that we know that if you build it, it doesn't necessarily mean folks will come. And one of my customers a few weeks ago said something that I really think is spot on. He said that the number one reason that digital transformation projects fail is actually cultural. It's org readiness. And the second reason is around sequencing, whether that's technical or financial. So we follow this Catalyst framework, and it's around helping teams and different stakeholders align around the problem and around the solution. And there's multiple philosophies or paths to accomplishing this. We take a double diamond approach within Microsoft, and back to that idea of empathy, that idea that the Microsoft team, you can go to the next slide, Shelley. The Microsoft team really wants to spend a lot of time up front in this research phase with our customers, kind of feeling in our gut what the front lines, what the patients, what the customers, your customers are feeling before we make any kind of recommendations. Yes, obviously we've got a point of view. We got a lot of Lego bricks we can bring to the table, but we really want to understand from their perspective first, what is going on before we make any recommendations and prototype. But we do these through our envisioning workshops that we deliver in person, at least previously, but we're doing a lot of these virtually now. Probably the most important function of this is food. We have figured out how to do food virtually, but there's some good deliverables that our customers get out of these, which is personas, health journey experience maps, and probably most importantly, a prioritization matrix. We really want to look for quick wins. Something we definitely don't want to recommend is, okay, everybody's been fighting COVID for the last 2 years. The teams are fatigued. We don't want to recommend a massive change initiative. Let's look for those quick wins that within 90, 120 days, et cetera, we can find real tangible value. And, standard Cotter methodology, how do we get that flywheel of momentum turning? Shelley, I will turn it back to you to make sure I didn't miss anything there.
Well, I think just wrapping up in this catalyst or envisioning workshop, as we have it called on the screen, it's really an ideation session. We like to sit down with you or your business stakeholders to understand what's truly top of mind. What are the biggest challenges? What are the biggest gaps that you're dealing with today? And we usually bring our industry specialists or executives that came from the industry. We have MDs and PhDs and ex-CIOs and RNs, on the team with us. And so we want to bring whomever you bring from the business, we will also bring from the business, so we can empathize with them and understand what they're really dealing with, to really unpack what is the goal, what is the problem we're trying to solve, what are some KPIs, what are some success factors in those, so that then, to Jake's point, we hopefully can, in a very short turnaround time, that 60-90 day turnaround time, we can go from prototype to production to really be delivering value to these end users, these consumers, these employees. And so hopefully, if that's something you're interested in, we would love to partner with you on. And so Jake and I, or Josh or Vasu, we might not be your Microsoft account team, but we definitely ask and recommend, if doing an envisioning workshop is something that you're interested in, or just learning more about what we've talked about today, please reach out to your account team and let them know that you heard us speak, reference the blog, or point them to Jake or I, and we will make sure that you get connected with the right people to have continuing conversations in this area. So we really appreciate you, and thank you for sticking with us today. We would love to pause for questions, to see if there are any new questions, or if you have some now, give you a minute to post them in the chat. We'd love to answer them live here if we can.
Awesome. Thanks, Shelley and Jake. That was fantastic. Before we go to some of the questions, I just want to call out, I put 2 links in the chat just a minute ago. The first is to the Nurse Hack for Health that Jake mentioned at the beginning of this presentation. And so it's a fantastic opportunity. I think this is our 3rd year doing it. It's been more and more successful every time. And so there's a link to learn more and sign up for that. And I also just published a link with several PDFs, kind of one-pagers and overview documents that illustrate some use cases of the cloud for healthcare providers. So definitely feel free to check those out. We do have a couple of questions, and feel free to keep them coming. We've got a few more minutes, but one of the questions was really about, customers who have like multi-cloud infrastructure. And so the question says, hey, most of our customers have a multi-cloud infrastructure, and what can we use, and from whom? So I guess the question, sorry to summarize, is when customers are on multi-cloud, how can we help them to navigate that across the cloud for healthcare to ensure that they are maximizing the synergies that they're experiencing across our product stack and some of the frameworks that we discussed?
Yeah, great question. Whomever asked that, and we can absolutely accommodate. Jake mentioned, when we talk about this, we can be or partner with you in helping you with all aspects of the platform, or with one or two. It can be very modular. So we can plug into the infrastructure you already have, or we can provide that infrastructure. So we aren't here to push solutions, on you. We want to, and that's one of the big components of the envisioning workshop, is to understand, what you have today, where you're trying to go, how we can leverage what you're already successful in using, but where those gaps are, and how we can help fill them. So that's more of a generic answer. To be more specific into your specific environment, we highly recommend you reach out to your account team, and we can dig into that specifically with you. Hopefully that helps.
Awesome. Yeah, thanks, Shelley. I think that's great. Maybe the last question that I see right now is, we do have not only other customers and healthcare providers, on the call, but some of our partners and some of the partners who I think were, included on the slides and in the discussion previously. And so they were asking, if there are examples of different partner-to-partner solutions within the Microsoft Cloud for Healthcare. And so how can, our partners better synergize across the partner ecosystem to help provide, added value for the customers that we're all trying to serve?
Yeah, that is a great question, and I have not thought of that yet, and would love for other folks to chime in. But the two we talked about today live were Truveta and Nuance, and so I'm guessing the question is like, how can Truveta take advantage of Nuance, or vice versa, or Innovacer, or the other partners on the slide. I think maybe the answer is Microsoft needs to do better awareness of those partner solutions, and connect those partners together. I know we have a lot of conferences normally in person. They've been virtual lately, but they're a great way to network and engage with, the Microsoft community, whether it's internal to Microsoft or partners. But I'm not sure who asked that, Josh, but maybe that's something that we can take back to our one Microsoft partner community and see how we can better connect our healthcare partners together, and reach back out to whoever asked, and get them plugged into that partner community.
I think that's a good idea. That's something that we need to dig into a little bit more on our side for sure.
Hey, Josh and Shelley, I can share. We've some of the local team here. We've been involved in a few projects with some customers where, yes, multiple partners have brought their own unique goodness to the project, and I think this is actually one of the benefits. It's not, again, standalone solutions for last mile here, and here that aren't connected. We do have a couple projects underway right now where partners are working together, and it's just making the provider even stronger because folks are coming together. So I think if it was a partner that was asking that question, definitely get engaged with your partner development manager. But we are doing this right now in the field for sure.
Awesome. Thanks, Jake. I know we're at time. I wanted to call out that this session's been recorded. We'll post that to the same blog post that was available to announce this session. So feel free to share that with anyone else. And then join us again next week and the next 3 weeks. We've got some great sessions coming up. The next one provides a fantastic illustration of Azure API for Fire and interoperability, and how that can be leveraged across our Power Platform and Teams. And then we'll continue to build on this sort of foundational Cloud for Healthcare session to talk about physician referral management and patient referral automation. So stay tuned for more, and feel free to follow the blog to get those announcements as we move forward.
I actually made this slide and there's a typo. We actually have a session next week on October 20th, which I forgot to include on this, where we're going to talk about patient message automation, and that link and meeting invite will be posted later today. So apologize for that, but thanks again, everybody, for joining us today, and we hope to see you in our next sessions coming up in the coming weeks.
Thanks, everyone.